change campaigns. And Nicola's going to share some examples in a sec. So Nicola is our content and digital manager, and I'm going to hand over to her. And just to mention, I was having some glitches, so I'm going to change devices while Nicola's talking and join again, hopefully on a computer that works. Over to you, Nicola.
Awesome. Thank you, Carolyn. So I'll just do some more techie things and share my screen. So just let me know when you can see that.
That's perfect. Perfect. Good. Thanks, Nicola.
Awesome. So as Carolyn said, we'll just be using some real case study examples to showcase some best practice scenarios. Just kind of to give you a bit of insight of the work that we've worked on and how we've helped some of our clients and how maybe we can help you in the future too. So the first thing I want to touch on, before we start any campaign, before you start, there's some questions that you should definitely consider because they'll act as the foundation that will kind of carry you through for the rest of the campaign. So what is your objective? Who is your target? What's your budget? Budget can also be in time and money. Often it's both, but when you have a limited budget, I often tend to think in time. How will you measure success? And then considering your customer journey, where they're coming from, where they're going, and where you'd like them to end up. And let me know if I'm going too fast. I tend to talk quickly. I'll try to slow myself down. So when it comes to reaching your audience, we've brought up this example from the ACPSEM, which is a very long acronym, but it's the Australasian College of Physical Scientists in Medicine. So we work with them on a wide variety of communications, and we often are tasked with simplifying, condensed, difficult, confusing content because we're not medical physicists ourselves. Although I have learned so much about medical physics now that I probably could be one. So in this example, we achieved reach by interviewing their members and creating short storytelling videos. So these highlighted areas that were really interesting to the community and the research that they're working on, achievements and et cetera. And it really did so in an authentic way. So the big lesson from this is leveraging your existing community, really reaching out to those people that are already there, are already big fans of what the college or what your organization is doing. And just using those people, integrating them into your content is really, really a big lesson there. Moving on to engagement. So this example we brought up, we work with a finance recruitment company called Moyer Group. So they deliver a wide variety of communications materials, as you can expect, because they're kind of managing clients and managing candidates. So we work with them to deliver those communications materials, which is anything from a blog post, a social post, larger scale campaigns. For example, we recently launched their ESG service. And also events, branding, and more. We kind of do everything for these guys. So this example that I've plucked is a really good example for engagement. This was shared after a blog post on the topic of personal development. So it just kind of ties in, it gives the opportunity for the audience to actually engage in the content in that live poll. So they can have their say, they can see what the community is thinking, and then we can also get some insights as to what people are thinking for future content. So it kind of ticks a lot of boxes, which is really, really great for engagement. And this is available in a number of different ways on platforms, but this particular screenshot is from LinkedIn. So then I'll move on to nurturing. So nurturing your audience, this example that is on the screen is from a really large campaign we did for Southwest Sydney Local Health District, promoting a suicide prevention service called Safe Haven. It's in all of the local health districts. So the big challenge that they had was nobody knew about them at all. People weren't using the service. So to reach their hard to reach audience, which is, suicide prevention, we don't know who might commit suicide. It's not something that is public knowledge. It's not something that's obvious. We underwent extensive research. So we did community consultation, people with lived experience, people who had like friends who had experienced friends or family members before we moved into the actual marketing phase. So it was really built on real local stories and opinions. And the result was a large-scale campaign that featured those locals that were comfortable with it, obviously, and also prioritized their needs. So in that nurturing way, it went beyond social media, where they could also find people across a number of channels that were also determined from that research phase. So we found out where they would go physically, and also where they would go in an online sense. And now, if Carolyn's got her tech all in order, I think I'll pass back to her, and she'll be talking about a large-scale mental health campaign that was built similarly through research and community consultation, and is also one of my personal favorites that we've ever done. It's a really incredible one. So I will stop sharing.
Thanks, Nicola. Yes, fingers crossed we have connection now.
Okay, cool.
So I'm going to share with you a real, I suppose, campaign example that brings a few different elements to life, I think. And this was a campaign that was conducted in the Murrumbidgee Primary Health Network, and it was live last year. So I'll just explain some history first. So we originally developed a campaign for the Murrumbidgee Primary Health Network, the one that's on the left-hand side of the screen that says life doesn't always go according to plan. We followed exactly the same type of process in developing the campaign. So it was very much insights-led, local. The main message, life doesn't always go according to plan, came really developed based on our consultations with the community. But it was in field for 5 years, which is a long time for a campaign. So there was obviously a lot of changes between 2017 and 2023. So we were asked to develop the campaign. And that's what we did is on the right-hand side. Some of the challenges had changed, the call to action had changed. And so you can see on the right-hand side that it was very much people-based, and I'll explain some of the process and the rationale there. So we followed a typical social marketing framework where we started with strategy and planning. We then did an initial co-design and consultation phase with the community, followed by concept development. We then took those concepts back and consulted with the community again. We then built out all the resources, had the campaign in field, and then measured pre and post campaign to see effectiveness. In terms of who we consulted with, we talked to a lot of people, and it was important to get to hard to reach communities. So we had a specific focus on them, and you've got some examples there on the right-hand side: rurally isolated communities, veterinarians, tradespeople, First Nations people, LGBTIQ community, and so on. What our research found were, I suppose, these 5 key messages. So people they see that they're on a journey rather than going to get well. So sometimes people want to fix a mental health problem, but it's more that people are on a journey to recovery or managing their condition. People want to feel empowered. So they want access to more pathways, formats, sources of information so that they can choose the type of help they want at the right time. So for some people, it's an SMS message, and others might be a call or online. I want to see myself. So as in, I want to be able to see if I come from people want a range and a diverse group of people represented in the communications. And it was important that it was local, and that came across as well. Stigma is not news, but it's a big barrier to reaching out and seeking help. And then people were really keen to have real stories and real people to make it more relatable. So what we ended up with was 5 key, I suppose, heroes. They're all local people. You can see tradesperson, farmer, someone who was originally a refugee, someone from the LGBTIQ community, and someone who was a First Nations, in fact, one of the first, a First Nations pioneer. And the campaign was centred around their stories. In terms of the marketing mix, it was promoted across a wide range of formats, and they were carefully chosen. So you can see digital, washroom, cinema, shopping centres, radio, etc. But they were chosen to give people the space to think, I suppose, often, not for example, washroom, where someone might, it's sort of a personal space, I suppose, that was important in the mix. And in terms of the formats we used, there was a television commercial, radio, and print. I would love to play you the television commercial, but I don't trust. Well, shall we give it a go? No, I'm not going to. I'll come back to it if we can at the end. It's because it's a beautiful execution. Out of home media, so you can see the buses and toilet doors and so on, as well as a large focus on digital. One of the key findings was that people want to be able to, as I said before, access different services depending on what their needs and preferences are. So it was core to have a landing page on the MPHN, the Murrumbidgee Primary Health Network website, where people could go and navigate, find the stories, and find a whole lot of different ways to access services that were, according to an individual's preference. In terms of, how successful was it? We're very proud of the success. So we undertook pre and post campaign evaluation. So that was done by independent providers and who interviewed a cross section of randomly selected community members in an online survey. And the first survey was conducted in March 23 before the campaign, and the second one in July 2023. And you can see that before we started the mphn.org.au/connect, so the call to action where people were sent, that didn't really exist. And at the end of the campaign, 25% of the respondents were aware. Access line, which was a phone triage line, awareness went from 12% to 33%. And there just a couple of other points for comparison of other services. And I suppose the other thing to point out is similar services that have been long-standing have a similar sort of awareness, around 25 to 30%. So we're really pleased to have built awareness of that pathway so quickly. So I'll call it a day there. But yeah, very happy to answer any questions, and I might share the link to the television commercial in the chat just because I don't trust my computer.
Sounds good. Thank you so much, Carolyn and Nicola. Does anyone have any quick sort of specific questions for either of them? And then we'll have obviously more time for discussion later on.
Yes, Kathy, it's Lorraine, and I can't help myself in asking the question because that's a very effective looking campaign. To set something up like this, most of us will be thinking, what's the budget that you have to be able to afford to be able to drive this kind of process?
Good question, Lorraine. Hello.
Hello.
Look, I think you're really realistically, it depends on the media spend. So it depends how wide you have to be. So Murrumbidgee is a discrete area, and they can buy regional TV that just gets to their area. And Southwest Sydney, we didn't do TV, but there was a lot of, specific to one geographical area. So the media spend's a big consideration, especially if you're trying to get across Australia. So I suppose for those very specific areas, which you might say, well, I can do that as a trial, to develop to follow the full process, do the community consultations and co-design, produce something that's a good quality and have the ability to test it properly in market, you're probably looking at about $200,000. National, I mean, I think you just have to be really smart with the budget you've got. Yeah.
Excellent. That's fantastic. That's very kind of you to give us a ballpark, because yes, I was certainly thinking that as well. All right, fantastic. Any other burning questions? Okay. All right, fantastic. Well, let's move on to Helen and then have some more time for discussion later. Oh, there you are, Helen. I just couldn't find you in my screen. Did you have slides, or were you
I do.
would you like to share your screen as well?
Sure. Hi, thanks so much for having me, and thanks for that presentation, Caroline and Nicola. Beautiful campaigns. Oh my gosh. Just goes to show the power of investing in communications, which was going to be my first point. So, okay, let me share my screen. Oh no, it's sharing the wrong one. Hang on, how do I share it? Oh, sorry. There we are, sorry. Okay, so I'm a science communication. Can you see that?
Yes.
Oh.
You could start there.
There we are, that's better. So I'm a science communications advisor to the Australian Prevention Partnership Centre, which, for people who don't know, was an NHMRC partnership centre for better health. So the idea was that research organisations around the country got together with policymakers to co-create research for the prevention of chronic disease. It's recently, the grant has finished, so we've now become an embedded program of the Sachs Institute, which again, its whole reason for being is to communicate research to policy and practice. So as part of the Prevention Centre, we've set up the Collaboration for Enhanced Research Impact, of which Prevention of Falls Injuries, CRE, is a member. So it's 11 CREs, all working in various aspects of prevention of chronic disease. And the reason it's relevant to falls is that obviously physical activity is such an important part of falls prevention. And what CRE does, this collaboration, is to sort of share our resources on upskilling early career researchers and practitioners, and also to sort of share science communications capacities. So I've been working with falls prevention for a little while, and just to say also, my in-laws are very old, in their 90s, and fall over at least once a week. So I am living this stuff. So really, really happy to be here today. So the first thing I wanted to really make the point was that investing in communication really matters. That's what we've learned at the Prevention Centre. We've got a very large, well-resourced and trusted team, currently 4 people. We were 5 until one recently left. And we do all different aspects of communication. So, producing products like policy briefs and podcasts and videos and the website, marketing, media, social media, engagement, and lots of other knowledge translation activities. And what's slightly different about us compared to a lot of research organisations is that the science communication team is really embedded in everything the centre does. So when there's a research project, we're right there in the first meetings talking about, well, how is this going to be relevant for practice? How are you going to describe that? What are your key messages going to be? How do you talk about the complexity of what it is that you're researching? So it's really rare, and it's a great luxury to work in an organisation that trusts communications people to that extent, and that's why I love the job that I do. So just some very quick things that we've learned about communicating to policy. The first thing you've got to do is have a plan. So these 4 elements are your basic plan for any sort of communication that you'd want to do, whether it's a great big advocacy campaign that we've just been shown in the previous talk, or whether it's sort of thought leadership. It might be a really small, bespoke, single communication about a research paper or a project. So the essential elements are to first think about your audience, number 1, think about the purpose of why you want this communication to go to them. Then you think about the key messages and the content, and then you think about how you're going to get it to them. So thinking about audience, there are lots of different people who have a role in changing policy. Obviously, the policymakers, I'm assuming, I don't know the world of falls prevention very well, but I'm assuming, you've got your health department and possibly transport involved, but there's also the politicians, who we would sort of view as, members of the public, really. Think about how much they know and what evidence and information they need to act. So understanding the audience is the essence of all communication, and it shapes the language you use, what sort of information you include, and why you do the communication. So, you know, I was a journalist for a long time with the Sydney Morning Herald. Every single day when I used to pitch a story to the news desk, they would say, yeah, but why do our readers care about that? That's what researchers need to think about. They often make the mistake of thinking, well, I've got this really important finding that I want to get out there, but try and flip it around to think about, well, what is it in your finding that this particular audience needs to know? And bear in mind that one research finding might be communicated in several different ways depending on different audiences. You know, the way you talk to, you know, I don't know, carers in a nursing home would be very different to how you would talk to a policymaker. So yeah, number one thing, if you don't remember anything else from the talk, remember audience. The second thing is the purpose of the communication. So I'm not talking about, you know, your broader objectives or missions of the CRE. I'm talking about the purpose of this specific piece of communication. So there are lots of different things. It might be to inform them about something new, or to, you know, contribute to the debate and make recommendations. It might just be to let them know that you've got a seminar going on, or something like that, or to get them to come to your website. So when you're thinking about the purpose, think about, what do you want the audience to know or to think? What's the absolute key top three things that you want them to know or think? And then go beyond that. What do you want them to feel? Because the purpose of a communication is to drive action. So it's not just, we can't assume that just knowing facts is going to get people to do anything. You want to engage them and get them concerned or inspired or interested to find out more. And then think about the next stage as a result of that feeling that you've engendered with them in the communication. What do you want them to do with that knowledge? How are you going to empower them to act so that they can go some way to fixing the problem that was addressed in your research? Okay, so that's the audience and purpose. Then when you're thinking about conveying messages to policymakers, the key thing is to think about the context. So policymakers are really busy, as we all know. They may not care about the same things that you do as researchers. I mean, obviously they're all involved in wanting to prevent falls, but you know, they might have a political imperative, or they might be, you know, worried about their budget or what have you. So a really important thing is to try and work out what is the context that your audience is operating in. It's difficult if you don't engage with policy very often. I'm sure you guys do a lot. The way we do this at the Prevention Centre is to hold regular policy dialogues on different issues, where we get people from all the jurisdictions in Australia to get together and sort of brainstorm things. And we have really regular meetings with our policy partners. Another way might be to look at the media around an issue, or the social media discussion. So, you know, what we've noticed we have a very active social media presence. And when it comes to falls, like, there's a really healthy debate around healthy aging, you know, so look at what the government's doing in that space, what might amplify your messages, what can you piggyback on? It's really worth doing your homework about, you know, government reports that are coming out, you know, yeah, just things that are coming up that you might be able to use as a hook for your communication. And then also, when thinking about the context, it's really important to think about who might be affected by your communication. So, you know, for us, we're funded by all the different governments in Australia, including the Commonwealth. So we've just had a conversation about, well, do we get on the bandwagon to advocate for a sugar tax? But we actually wouldn't do that, because that might adversely affect some of our funding partners, and the relationship with them and maintaining that engagement with them is a really important thing. So yeah, just a few things to think about there. Then when you're writing your key messages, this is the things that you want the audience to remember. So, I mean, I work with researchers every day, and you know, when you're writing a journal article, you want to put everything in it to show that you've done the research, but we're sort of turning that on its head. We want to boil down everything you know into just the top 3 or 4 things that you want people to remember. So if they're just going to remember a few things, if they don't read any further, what is that main thing? It's normally what can be found in the discussion part of a journal article. So as a journalist, that's where I go first. I don't read all the rest. Well, I do read it, but not first. The policymakers, as a general rule, don't necessarily need to know about your methodology. They trust you. You're an expert. You're a thought leader. It's really important to have your papers at hand to provide them that evidence. The evidence is crucial, but what the purpose of the communication is to get them interested in pursuing the evidence further. And then when you've got your key messages, think so what? The so what question, and this can be really hard for researchers to do, but I think this is what a comms team can bring to the equation. So what is in the findings of your research for them? So when you've given them your policy brief, or they've read the newspaper article or whatever it is, they should never be left at the end thinking, well, what was the point of that? What does it mean? What am I supposed to think about it? If you haven't resolved those questions for them, then the communication has failed. So think about, why do you care about the topic? Why should they? Why is it relevant for them? What's your passion about it, or your personal experience? That an element of that always helps. And what are if you don't know what their context is and why they should care about it, try and tap into some central core values. This is the values-based messaging that Vic Health is so good at. So, what are the central inalienable truths that everybody would agree with that you can appeal to? What's the care factor? And then the final thing I wanted to say is, there's a plethora of different ways you can get communications out there. So the ways that we do it at the Prevention Centre, we have 2 regular newsletters, the Chronicle and the Prevention Post. The Chronicle is a public-facing newsletter that goes out monthly, and Prevention Post is weekly, that collates events and opportunities and news all about prevention. If you haven't signed up to those, I really encourage you to do so, because it's a really good way of keeping on top of the debate and working out what's happening in the field. We do, findings briefs, which are summaries of our key findings, fact sheets, knowledge syntheses. We've got a very active website and a very strong social media presence. And the other thing that we've done through CRE is to produce a communications user guide 101 specifically aimed at CREs. So in there, it's just the very top level, how to write a comms plan, how to write in plain English, just a few tips and tricks. But please do contact me, because that's what I'm here for, is to support the CREs. We also have a communications community of practice for 1 or 2 people from each CRE, and you are very welcome to attend that. And that's where the comms people from all the CREs get together. A lot of them are researchers, they're not professional comms people, and we just nut out, the burning topics, like, what platform do you use for your newsletter, and what do we do about Twitter, and that sort of thing. So we would love to see falls prevention at that. But please come to me for any questions. Stop sharing.
Oh, that was so helpful. Thank you so much, Helen. That's amazing. Does anyone have any burning questions for Helen, or we save them for the discussion? Fantastic. Thank you so much. Let's hand over to Megan now. Did you have slides as well, Megan?
I do. Yeah, thanks. So I think I've just
share away. You have. Perfect.
You can see my slides.
Yeah.
Right.
Do you want to just start the presentation as well?
Do see what happens. Am I going to lose?
It's not essential. We can see it.
I just lose my notes with that one.
Yeah, that's okay. If you want to
I just want to make sure that I know and show.
Yeah, that's okay. Just leave it the way it was that first time.
I hit the wrong one.
Oh, good.
You've got them again?
Yeah, that's good.
Good. Cool. Thanks everyone for giving me 5 minutes. I hope I'll be conscious of the time. So I just wanted to tell you about some work that we've begun to undertake. It's titled The Effectiveness of Social Media in the Dissemination of Knowledge about Falls Prevention in Older People. I will move on. So our aim is to increase the awareness of falls prevention and bring attention to the need to put falls policy back on the national agenda. This program or project that we're going to undertake has 3 phases. The development phase, which I'm going to spend most of my time talking to you about, but then followed by a campaign phase and an evaluation phase. The campaign's aim is to, as I said, raise awareness about the importance of falls prevention and start a conversation about the need to put falls on the agenda. It's going to use scientific information to disseminate. We'll disseminate that through the use of engaging and accessible digital content, and we will then compare that. So we've got 2 pre-campaign, this control period and campaign phase, and we'll be able to compare the mean number of tweets or posts posted against that control period. We'll also include in the campaign the launch of a YouTube video and the go live of an online repository, which will include a story page where viewers can view stories of people's personal experiences with falls and engage with us through an online survey. Then it will have an evaluation phase. So we will use a longitudinal data collection strategy to obtain web and social media metrics over the 6-month campaign period. We'll aim to measure reach, scope and engagement with the campaign and the online repository through things like web-based analytics and hashtag analytics. And this seems to be consistent with metrics used in similar studies that have measured the impact of social media initiatives and online resources. We'd also like to perform a content evaluation on the social media posts, and for the online repository, we would like to evaluate the number of viewers through Google Analytics and use quantitative and qualitative methods to evaluate the survey that was attached to the YouTube video. Where I guess that's not an exhaustive list. There might also be other data we would like to collect. So back to the development phase. This is really the first step of the project, and it starts with the creation of a hashtag, which will be used for the development of content for the social media campaign. To do this, we undertook a process of engagement to find a hashtag, and we used last year's ANZ FPS and World Falls Congress to ask delegates this question: help us create a catchy and meaningful hashtag to increase awareness of falls prevention research across social media platforms. We used a website called Poll Everywhere, and we actually got, I should tell you, we got our UNSW Human Research Ethics approval to do this. We got asked delegates that question. We got them to log on to Poll Everywhere that we kept open for 2.5 days, where they could upload their idea for a hashtag and also up or down vote other people's ideas. And we had 76 people, or 30 people respond and gave us 76 responses. Then on the last day, sort of at the very end of the last day of the conference, we actually took the top 9 hashtags that and exported them into Mentimeter, so we could get all of the delegates to vote for their favourite hashtag during a live poll session. So we had 101 registered votes on that Mentimeter session. On the screen there, you can see the top 9 hashtags and the winner, which was no falls, no falls. So of note, there were also quite a few iterations of don't fall for it that rounded out the responses that we got. Then today, we're officially launching this development phase. And so the phase will involve these things. We need to confirm that hashtag no falls would be something that we would use for the duration of the campaign. We need to create content used for the campaign and also create a launch video. We need to finalise some fact sheets that have been drafted in line with the falls guidelines, and they've started the process of consumer feedback with them. And we also need to recruit people with a lived experience of falls. So this includes people who have had a fall, carers of people who have had a fall, or medical and health professionals that work with people who have had a fall. To do this, we've actually submitted ethics that will get seen next, heard at next week's UNSW Ethics Committee. But we know that in order to make something like this a success, we actually need to engage with a broad group of people. We have the support of the ANZ FPS, of the CRE, of the New South Wales Fall Prevention and Healthy Ageing Network, and NARI and NURA, but we need support through from others, and we need support through the campaign to propagate social media tweets and posts. We need hands-on help to develop content and to recruit people to tell their story, and also to analyse all the data that we collect. That's all.
Fantastic. Thanks, Megan. It's a massive amount of work just to get this far. So well done to you and the team. So we've got some time for discussion. I also just wanted to call on Lorraine Lovett to talk a little bit about the Rotary links, if that works for you, Lorraine.
Yep. Sorry, I have just put together a couple of slides just to put it in context, if you like. So I'm just going to share my screen. And I'll just go to the beginning. Sorry, slideshow. I was caught up doing something else. You caught me out.
Oh, sorry.
Yes, no, that's fine. My view, my thing. Okay, can you see this one?
Not yet. Oh, yep, it's coming.
Okay, so for those of you who haven't met Bob Barnes is a consumer who lives in Lismore, a typical Aussie who is a consumer that spoke at the launch of the New South Wales Fall Prevention, the Falls White Paper, or the launch for that we had at NURA in November last year. And the story for Bob and how we got to his promotion is that his wife, through various means, was very sick. She had shingles and then had falls, and she actually fell in a motel. She tripped on a rug. Following lots of intervention, she's back now after stepping on program and other intervention. She's up and about and looking great from where it was, but it frightened him. And his comment to us was that he just had no idea what a fall meant. He didn't know the impact it would have on him and his family. So he and his son particularly started talking about the launch of his launch of a Rotary Safety Lights for Seniors Fall Prevention Project. And this is the first sort of draft that he did in October last year that he started circulating. And he did this in consult with us at the network, Walls Network, with Stephen Lord, and also he took it to his local members of parliament and to the New South Wales Ministry of Health. And then through combined government, he was able to get some funding to support an initial project around this. And it started with safety lights because he was concerned at night. His wife couldn't see, so he thought that was a good angle to start saying as to doing it. So that evolved into a couple of last year in northern New South Wales, both in Ballina and in Lismore, having displays in Bunnings. And he's worked closely with Bunnings, and you can see a table there, and he's got his mates, Bob over there on the left-hand side, and his mates. And his mates came along from Rotary, and they came with their chair and they came with their paper and thought they were just going to sit there and hand out information. But actually, people started asking them questions and talking, and the mates got up and started talking. This is a serious incident, so this was issue, and gave them guidance, and they really got involved with the feedback we've had. So this was lovely, having older people themselves talking about the importance of falls and prevention as well. Now, I've just received an email today where they're actually now setting up for April this year again in northern New South Wales in Bunnings, and Bunnings coming alongside with them. But effectively what he wants to do is to develop a network of Rotary clubs with engaging messages and significance of falls by seniors and the importance of raising awareness and doing something about it. So the vehicle he has chosen is through Rotary. He's the active member of a Rotary club up near where he lives, and he feels that by developing a series of resources and means to promote to other Rotary clubs, encouraging them to go about running their own campaigns as well, supporting local communities. So he's looking at developing the resources for Rotary clubs to pick up the resources that they're doing and really complementing each state in what they're doing with falls. So the work that he did in Lismore, he worked with the local health promotion team and had active members there, and he had a lot of the resources that we've developed both through the network and through the CEC as well in regards to falls. So he is now at the stage of sharing his bigger plan, and we're in discussion with him through Kathy and Kim in regards to he wants the way they were going through it, the resources they're developing, and also to get some endorsement from the Australian New Zealand Fall Prevention Society, the New South Wales Healthy Ageing and Fall Prevention Network. So there's a lot of areas that we could endorse this so that people feel that it's credible and it's being backed by researchers as well. And his favourite saying is, you want to go fast, go alone. If you want to go far, go together, which is an African proverb that you've heard. But I had to laugh, and I put these in just for some of the things that he was throwing to us. Remove trip hazards. A trip at home can cost you more than a trip overseas. And he's looking at prominent people who can make these kinds of statements. Get a nightlife, you need to see. He's coming up with lots of different things. April Fools is no joke, possums. And if people say it can't be done, tell them they're dreaming. So his whole idea is that we need a high-level campaign. We need some very high-level people with a bit of fun to it. And his biggest other issue in all of this is the fact that he feels that we've had other campaigns, Slip, Slop, Slap, a range of other different campaigns, Life Be In It in years gone by, and he's seeking now to see how we can lift that and elevate it more to a higher level with simple messaging for people. So that's a work in progress that we're working to share with Bob at this stage. Any questions in relation to that?
Yeah, fantastic. Thanks, Lorraine.
Just got to work out to stop sharing now.
And yeah, I think, that's a great statement. So I think, we've all got, competing priorities and juggling multiple things, but, we're really keen to sort of work out how we can kind of work together to bring together these different kind of pockets of action and expertise. Yeah, would anyone like to make a comment? Suggest a solution, ask anyone else a question?
Yeah, I'll just make a comment. I think I've been involved in a national campaign to try and increase the awareness of the value of physio, and we spent a lot of money and didn't change the dial. So from a national point of view, media is really expensive, and to do something, a national program around falls prevention is going to require millions and millions of dollars, and therefore it's going to need obviously government and funding support. I think what Bob is doing through Rotary and knowing your audience, which is some of the message from the previous speakers, that targeted approach is going to be really, really valuable. And I think going to help us getting big community organizations on board to sell our message that we're passionate about is a really positive direction.
Well said, Rick. Terry, and then Kim.
Yeah, thanks. Thank you to all the speakers for sharing us their thoughts. I guess this is a general question, and I'd be happy for any of the speakers to jump in. The real impact of messaging campaigns, you've got the impact of the message, the reach of the medium, and the cost of the medium as well. It's a difficult balancing act, it appears, but do you have any thoughts as to what you think is probably the best strategy to meet the target at-risk audience who you're wanting to change? Is it mass media? Is it social networks? Is it some sort of combination? What do you see as, I guess, that most cost-effective overall approach?
I'm happy to jump in.
Please
and
do.
make others as well. Yeah, great question, Terry, and also great comment, Rick. Yeah, the best advice, everyone has a limited budget, even big organisations, and it's very competitive to get the voice space, I suppose. So one of the most effective ways, I'm going to probably, I think Helen might have alluded to this or had this on her slides, is being really focused about who you're trying to get to, and having a very clear strategy. So you could, for example, say, all we want to do is get this on policy wonk's agenda. Or all we want to do is get it on the government's agenda. So that's who we're targeting. Or you might say, all we want to do is get it on people who've had one trip to emergency with a fall. And think about your networks, and what you have to work with what you've got, and what you have got is an amazing network. You want to make sure you're not talking to yourselves, but somewhere, that access to Bunnings is massive. So, and access to Rotary. Rotary is a great mechanism, I would say. So thinking about what can you do, it's common, not, that example with a big budget is unusual. It's much more common to have less funds. And so it's about how can you chip away, keep building strong resources, really focused strategy, and consistency.
Thank you. Helen or Nicola, did you want to add anything to that?
I'll just say, with the target audience, I think maybe that going through the PHNs and targeting people who have had a fall might be a good idea. And just, this is not evidence-based at all, but just from my own experience, people in that demographic love something printed, like a little brochure or a poster. And the other comment I wanted to make is I love the Rotary's use of humour. I just think, we can try and be too worthy with some of this messaging, and it really runs the risk of alienating people, especially if you're telling them to do things they don't want to do, like exercising. So bringing in a bit of humour, I think, could probably be very effective with not too much cost.
Awesome, thanks. Nicola, anything to add?
Yeah, I would say similar to Carolyn, go where your audience already is. And I don't think you need a big fancy budget to do a large research project. Just ask the people who you're already in contact with, ask them how they interact with media. If you're looking to go into, deciding a channel, for example, just have quick conversations with the people that you're already in conversation with, and just ask the questions that you want to know. I think that that's the best way to kind of kick off, and do so if you have a limited budget as well. Yeah.
Amazing. Thanks, Nicola. Before I go to Kim and Amanda, I'm actually going to put someone else on the spot whose name is Heidi, and ask her to just share what she did recently about getting the message out.
You want to remind me what I did, Kathy? Are you talking about my latest job, my latest unpaid job?
Yes, your column.
Oh yes, yeah. My local community newspaper, The Bugle, they actually ran an article about a recent fall prevention activity, and I just commented and said, "Oh, it would have been great to have some really practical advice," knowing as I gave that comment that I would get a job out of it, which I did. Now I have a monthly column in the local community newspaper, which is due today. Actually, my first one. Yeah. I've been taking notes. I've got the top 4 things I have to write.
Fantastic. I think that's a great idea of like harnessing, great example of kind of harnessing energy and the network. So yeah, amazing. Well done, Heidi. Kim.
And my question was very similar to Terry's one. Like essentially, we have no budget. That's not a lot of budget. But what is, like what would be our best bet? Like, and I'm not talking about target audience, because we really want to get the message out to everyone, saying that falls is something that you can prevent. And we know how to, and we can keep that message as simple as that, or add a little bit more to it. But what would be our, like we are, like, as Megan is saying, like we are collecting interviews and we will ask all those questions, like what type of media that people are using, and we'll get a bit of an idea through that. But I don't think it will give us the answer of how to do it. Like that's kind of where your expertise comes in. And if you would kind of have to, like, even if it's a top 3 of things that are likely to be successful, or a top 1, with a limited budget, but you know, with a very strong message, how do we go about this?
Excellent question. Carolyn, Helen, Nicola?
I'm happy to jump in on this. I think the easiest, lowest budget thing you can do is with this tricky little device you have in your hand and people in your community that are willing to get behind the camera. I think that that's the most effective thing that you can do, is record and share real stories. And sometimes that feels a little bit like pulling teeth in a different way, because not everyone's comfortable to get in front of the camera. But if you can really find those people that are, that's one of the best things. A quick 30 to 60-second video, sharing that with your community that then can be shared further. I think that that's absolute gold when it comes to marketing. And it's quite easy, but it's just a matter of getting that right person that will actually do it. Yeah. That's the hard part.
I think that's an awesome suggestion. Yeah,
I'll jump in as well. When it comes to communicating to policymakers specifically, that there are ways that are free of becoming part of the conversation. So, you know, writing opinion pieces for the conversation or for the media, you know, just becoming thought leaders in the area so that people are more likely to come to you, and, you know, just contributing to submissions and that sort of thing. So just getting involved in the debate just to raise your profile as a centre, which will then lead on to the conversations that might actually change policy.
That's both great tips. I'm going to chip in something different. I am not that close to the academic research, but I feel sure that there is published research about terminology and the language that resonates with older people. And I'm going to guess that mentioning falls and fall prevention is a turn off or something that people just do not relate to. So even if it works for health professionals, you may find if you're trying to get to Joe average, you may need to think about using different language. Yeah.
Really good
Absolutely,
point.
we're very much aware of that. Don't mention the F word. It's been a saying that's been going around for a while.
And Amanda, who also has a lot of experience in health promotion.
Yeah, just a comment. Great presentation. So really enjoyed listening to those. And I was just, I guess, wondering about conversations with sort of state health departments from a health promotion perspective. At the moment, I guess we're sort of feeling that support for falls prevention is slowly being withdrawn, and the conversation is around healthy aging and with sort of, I guess, decommissioning support or withdrawing support for programs such as Stepping On, and putting that back onto the local health districts if they do want to continue with those. There won't be any support, beyond the next 12 months or so, and just how what we offer can support campaigns. And anyway, just a comment. And yeah, I don't know if Lorraine, you have any insight into that?
No magic or no insights, Amanda, and I concur with what you're saying. So I guess it depends on how we can be more effective in the messaging from the white paper that we've developed up, and that's in discussion now. So it's been an ongoing issue for a while with us in that regard, Amanda, as you're well aware. So we just keep working on it. Thank you.
Yeah, okay, thank you. I do have another meeting.
Yeah, no, I think probably everyone has other meetings. So that was fantastic. I guess I'd like to propose that we actually have a bit of a kind of communications working party And so, yeah, let's send an email and sort of see who'd be interested in, kind of continuing these discussions, and perhaps continuing to engage with our fabulous experts. So thank you so much, everyone, for your presentations, everyone for your input, and let's keep working together to make a difference.